Yes, thank you very much. I'm happy to be here with you today. I'm Dr. Wilfred Arubagu from Bara University of Science and Technology in the Department of Dental Surgery, Faculty of Medicine, where they train doctors, where they train nurses, where they train pharmacists, and other types of healthcare workers. Today, we are going to learn about oral hygiene. Oral hygiene is how you can take care of your mouth. And I'm sure all of you know what the mouth is. Now I'm going to show for you how the mouth looks like. This is what we call a model. This model shows for you how the mouth would look like. And here, these red parts are the lips, and what you are seeing here white are the teeth. This model is for old people, adults, people who are above the age of 16 to 18 and older. But some of you are still very young. Your teeth may not be of this type. So that brings me to tell you briefly about the teeth. You know that there are two sets of teeth. First, when you are born without teeth in the mouth. The teeth are still inside the gum. But after 6 months, the teeth start growing. You will see in front here, 2 teeth will come out, then another 2 will come from up, and slowly by slowly, all the mouth will be filled with the teeth in children. And that type of teeth in children, in young children, is called milk teeth or deciduous teeth. Deciduous means that the teeth are going to fall away, and then they will be replaced by the permanent teeth. The permanent teeth are now these ones. Now, something which you need to know about the deciduous teeth is that the deciduous teeth are fewer than the permanent teeth. There are only 10 sets of the deciduous teeth down and another 10 in the upper part of the mouth. And these are usually the incisors, the canine, and the molars. But when those teeth fall off, they will now be replaced by the permanent teeth, which are 32 in number. 16 on the lower jaw, 16 on the upper jaw, as you can see here. And they are the incisors, the canine, molars. Okay? So now that you know that the milk teeth in children after the age of 6 start to be replaced by the permanent teeth. And so it is very important that you take care of your teeth very well, because if you don't take care of your teeth very well, they will get damaged and you will lose them. And there are 2 main types of diseases that can affect the teeth because of not taking care of them. One is gum disease. Gum disease will make the gums to become red. They will start bleeding. They become painful. Here is your gum. Your gum is here. Okay? It will become red, and when you try to brush, it will be painful and it will bleed. That is painful because there is wound which will be on the gum. And when this stays for long, the teeth start becoming loose. And when they become loose, they will start falling off one by one until they are all finished. And so that means you will have no teeth left in your mouth. The other second disease which can affect the teeth because of not taking care of them is what we call dental caries. Dental caries is the disease whereby the particular tooth which is affected develops holes. It develops holes which we call cavities. Will form inside the surface of the teeth or in between the teeth. And there are a number of reasons why these holes form inside these teeth. The reasons are that you have not taken care of your teeth very well, you have not brushed very well, and yet you eat a lot of food which contains a lot of sugar, like taking too much sugar in your tea, putting too much sugar in your milk, putting too much sugar in juice and other drinks, taking other drinks which have too much sugar. I will show for you this later. Now, this sugar will combine with germs in the mouth. Those germs, we call them bacteria. These bacteria will start digesting or breaking down the sugar into small particles, small particles which produce acid. This acid is what will melt the hard part, this hard part of the tooth. This hard part of the tooth is made out of what we call calcium. Calcium is a mineral, so it is the one which makes the teeth to be hard. Now a particular tooth is in layers. The outer layer of a tooth is called the enamel, and the enamel is the hardest part. This one which is outside, the one which you can see, it's the enamel. It's the hardest part. Now inside the enamel is what we call dentin. Dentin is hard, but not as hard as this white enamel. Then inside the dentin is what we call the pulp cavity. Now the pulp cavity is just soft. It has blood vessels, and it has nerves, and it has small vessels which we call lymphatic vessels, which are used for draining the waste from the teeth outside. And so all this, the pulp is a living part. It's just like the other blood vessels, nerves inside your body. And so when the acid destroys this hard enamel, then it will go inside and it destroys the dentin. And once it destroys the dentin, now the pulp will be exposed. It is like cutting your skin and putting all sorts of things inside your muscles. Okay? You will get pain, and the pain will be so much that for the children, they will start crying around. They will refuse to eat because the tooth will be so painful. And so you will run and say, oh, please remove my tooth because it's paining. And that will lead to, again, you losing your teeth. Okay? So that is the reason why you need to know about oral or dental hygiene, the care of your teeth. It is just like every day you wake up, you need to bathe. So you also need to bathe the teeth. Okay? When you become dirty, your parents will tell you, go and bathe. So when you have eaten anything, also go and bathe your teeth. We have just learned about the teeth, and we have learned that the teeth are very important for our health, because if you don't have the teeth, your feeding will not be good. You will not be able to eat meat. You will fail to eat hard food like maize and others, which are very necessary for your body. So that's why it's important to take care of your teeth so that they can last and last long. And so I thank you very much for having been very attentive, and so I see you next time.